Good morning and good afternoon, everyone, depending on where in the world you are. Welcome to our webinar on the Global Gag Rule and beyond, U.S. foreign policy and abortion. We'll be starting in just a few minutes, and at this time, you should be able to see the first slide of our presentation. If you can't see the slide, please use the chat box to let us know. And again, we'll be starting in just a few minutes. Okay, good morning and good afternoon, everyone, and welcome to our webinar on the Global Gag Rule. We're going to get started now. Please use the chat box at any time to notify us if you have problems hearing or seeing our presentation. We'll be taking time for questions and discussion after each presenter, so please wait until after each presentation is finished, and then you'll be able to ask your questions or share comments via the chat box. Please note that this webinar is being recorded so we can share it with our colleagues who couldn't join us today. And now I'd like to introduce you to Patty Skuster, Ipas's Senior Policy Advisor for Technical Innovation and Evidence, who will get us started. Patty?
Hi, thank you, and thanks to everyone for joining us. I see we have an excellent mix here of Ipas staff, partners, and friends from around the world, and we're glad that you were able to make time this morning. If anyone has colleagues who are unable to be here today, please note that the webinar will be recorded, as Jen said, and so you'll be able to share a link to the webinar with them. We'll send that afterward. So welcome. First, I want to appreciate our many partners who are working on Global Gag Rule advocacy and education. And because of all of that work, for many of you on this call, you have a good understanding of the Global Gag Rule. But what the Global Gag Rule requires for US grantees can be confusing, and the rules do change, most recently in March with an announcement by Secretary of State Mike Pompeo. So firstly, the objective of this webinar is to educate our staff and partners on the rules of the policy to try to prevent misinterpretation. Second, we want to inform you of some of the ways that the policy has harmed Ipas programs and ask you to share information about what you might have seen around impact of the Global Gag Rule. And lastly, on another harmful US policy, we want to leave you with a more positive outlook and update you all on movement toward repeal of the Helms Amendment. Next slide. Here are our presenters. First up is Jonathan Rucks, who's Senior Director of Policy and Advocacy at PAI. And Jonathan knows the ins and outs of the Global Gag Rule, and we've really relied on him and PAI to help us understand the policy to the most minute details. Following Jonathan, I'll speak on the harms of the Global Gag Rule to Ipas, where I oversee our US foreign policy work, and I also am working to monitor our programs for Global Gag Rule impact. And lastly, we'll hear from Ipas federal policy consultant Gus Gustafson, who currently steers our work from Washington, D.C. And Gus will help us look toward a potentially rosier future with an update on work toward repeal of the Helms Amendment. And to repeat what Jen said, we'll pause at the end of each presentation to give you all a chance to ask questions in the chat box. So now I'll turn it over to Jonathan.
Thanks, Patty. I just want to say that at the outset, I know some of this is going to be a little bit of a refresher, but I think it's really important that we start at the beginning and that we really recognize what this policy does and that we're all on the same page because we get a lot of questions about this. And I think whenever we are out in the field, if anybody can take a moment to help walk a partner through this, that will help prevent some of the over-implementation and self-censorship that we see as a result of the punitive nature of this policy, which really scares people and leads to that over-implementation and self-censorship that we see. If you could take me to the next slide. So, as a reminder, one of the first things that President Trump did upon assuming office was to sign a presidential memorandum regarding the Mexico City policy. This memorandum reimposed the Mexico City policy that was in effect during the George W. Bush administration. And at the same time, he directed the Secretary of State to draft a plan to extend the policy to cover all US global health assistance. So extending it beyond family planning and reproductive health assistance as it had been implemented in previous iterations. What the Global Gag Rule does is it prohibits US global health assistance from being provided to foreign NGOs, so non-US based NGOs, who perform abortions in cases other than a threat to the life of the woman, rape or incest, who provide counseling, which includes advice or information and or referral for abortion, or who lobby to make abortion legal or more available in their own country, even if these activities are performed with funding from other non-US government sources. It's also important to recognize that this policy itself and expansion to all US global health assistance took effect in May 2017. And at that time, it was renamed Protecting Life and Global Health Assistance. As advocates, though, we still refer to this policy as the Global Gag Rule because that's what it's doing. It's effectively gagging the ability of organizations to use their private funding to provide comprehensive services. Next slide. I want to be really clear here that the Global Gag Rule does not prevent the use of US funds for abortion. This policy is not, has never been about US taxpayer funding for abortion. I know Gus is going to talk about the Helms Amendment a little later, but I do think it's important just to say that although unsafe abortion is the leading cause of maternal morbidity and mortality in the developing world, the Helms Amendment has been in effect since 1973, and this amendment restricts the use of US foreign assistance funds for abortion as a method of family planning. What the Global Gag Rule does is it denies foreign organizations who are receiving US global health assistance their right to use their own non-US funds to provide information, referrals or services for legal abortion, or to advocate for the legalization of abortion in their own country. Next slide. It's really important for us to recognize how the Global Gag Rule has massively expanded under President Trump. So as I said before, in past iterations, the restrictions only apply to US family planning assistance and reproductive health assistance programs. Trump, though, has shifted that, and now it's covering all US global health assistance. So if he had acted like his predecessors, we would be looking at about $575 million in family planning and reproductive health assistance that would be impacted. Those impacts still would have been great given the shifts in the reach of that funding in country, but now those impacts are multiplied, by this expansion to US global health assistance, which encompasses almost $9 billion in funding. So under President Trump, we've seen this policy expanded by 15 times and affecting 15 times more funding. Next slide. The expansion of the Global Gag Rule now, as I said, encompasses all US global health assistance. And when we talk about global health assistance, we're talking about everything from HIV/AIDS programs to malaria to nutrition and WASH. All of these partners and providers who are working with this funding, many of whom have never had to deal with implementing this policy, they're now being faced with it. And we're looking at 60 plus countries around the world who benefit from US global health assistance, who are at risk of having impacts as a result of this policy. And I think it's really important for us to recognize that even when this policy is not in place, the Global Gag Rule is still there with this chilling effect. It lingers, it hangs on. And the expansion of the Global Gag Rule to all US global health assistance has only increased the chill that we're seeing in countries around the world. And that chill manifests itself in the form of self-censorship or cutting off of legal services, a reluctance to partner with organizations who aren't complying with the policy, and over-implementation of the policy. And really, it's key for us to push back and combat that chilling effect. And the way to do that is to really understand what the policy says, what's allowed. Yes, it's an incredibly prohibitive policy, but there are activities that are allowed and can and still should continue, and to really understand how this policy should be applied. Next slide. So this is the big shift, and this marks the second expansion under this administration of the policy. And this is a pretty technical shift, but it's really important to recognize that this new interpretation of existing language is going to have a pretty big effect and really expands the reach of the policy. So in April of this year, Secretary of State Mike Pompeo announced this new interpretation of language, existing language, that's in the standard provisions. And the standard provisions are the implementation guidance for the Global Gag Rule. The US is now saying that if you are a foreign NGO who agrees to comply with the Global Gag Rule, whether you're a direct recipient of US global health assistance or a subrecipient of US global health assistance, if you agree to comply with the policy, you now are prohibited from providing any financial support to any other foreign NGO that conducts activities that are prohibited under the policy. I know that's a lot, but what this means is that the US policy is now being extended to any and all funding. That's funding from other bilateral donors or private foundations, for example. It's being extended to any and all funding that first flows through an organization that is complying with the Global Gag Rule. So this means that we're going to have providers and partners on the ground in country who could conceivably have no financial relationship whatsoever with the US government, who now are being forced to comply with the Global Gag Rule. The next slide. So let's stick with this a little bit and look at some before and after. This slide shows how we operated before this April announcement. And the goal here is to show and illustrate why this interpretation, this new interpretation, is completely unnecessary. Organizations who are complying with the Global Gag Rule cannot accept funding from other donors to engage in any activities that are prohibited by the policy. To do so would mean that they would no longer be in compliance with the policy and they would lose their US Global Health Assistance funding. So we know that the Global Gag Rule attaches itself to US Global Health Assistance funding. And any funding, any global health assistance funding that the prime compliant foreign NGO policy language has to be attached there. But the policy language should not attach to funding from other donors that has nothing to do with activities prohibited by the Global Gag Rule. So that funding on the blue side that's coming in from other sources, again, that main compliant organization can't receive funding that would run it afoul of the Global Gag Rule anyway. So there should be no need to have to flow this policy down on any and all funding. Next slide. Unfortunately, the US chose to implement this new interpretation, which drastically extends the overreach of the Global Gag Rule. Again, this new interpretation says that any and all funding that flows through an organization who's complying with the Global Gag Rule, that funding can only go to organizations who agree to no longer provide abortion services, counsel or refer for abortion, and who also can no longer advocate for more liberalized laws around abortion. This new interpretation is going to have enormous implications for a variety of donors, ranging from non-US bilateral donors to private foundations, even to other US government funding streams outside of global health. This interpretation is also going to place an enormous burden of compliance on those organizations who are complying with the GGR. And moving forward, they're going to be required, before they subgrant any and all funding, not just US Global Health Assistance, they're going to be required to conduct what the US government is calling due diligence on their subrecipients before they can provide them with that funding. So these organizations are now becoming the enforcers on the part of the US government to extend this policy to any and all funding. You can take me back one slide. I think because this is so confusing and so new and so expansive that it's a little bit helpful maybe to walk through the before and after using kind of a visual. So let's say, for the sakes of our discussion this morning, that our compliant organization here at the top is a fictional NGO. We're going to call them Girls Health International. And this fictional NGO receives funding from the US government. They receive US Global Health Assistance, which is why they have to comply with the policy. They also receive funding from private foundations and several other bilateral donors. So for this example, let's say that Girls Health International is implementing a project with private foundation funding in India. And with this private foundation funding, they're working to ensure that girls in school have access to sanitation services. And key to their implementation of this project in India is their ability to work and to subgrant this funding from the private foundation to local partners there who are experts in this issue area. And under the before, so under this slide, Global Health International can accept the funds from the private foundation because they have nothing to do with any of the activities that the Global Gag Rule prohibits. Again, this is funding to ensure that girls in school have access to sanitation services. And then GHI is going to further subgrant that funding to the partners in India. And because this, again, has nothing to do with any of the prohibited activities, it's not US Global Health Assistance funding, Girls Health International should be able to simply subgrant that funding to the local partners because they know that with this funding, they are not going to engage in any of the prohibited activities. It doesn't matter what the local NGOs in India are doing with their other funding. The Girls Health International is primarily concerned with what's happening with this funding they're flowing down. And it has nothing to do with the prohibited activities. So they should be able to separate things out. If you take me to the after, the US government disagreed with that interpretation. And what they're saying now, if we continue with this example, before Girls Health International can subgrant that funding coming from the private foundation, again, funding that has nothing to do with any of those prohibited activities, before Girls Health International can subgrant that funding to the local partners in India, they have to have a conversation with them about what they do with all of their other funding. And if those local partners in India want to work with Girls Health International on this project, they have to now agree that even with all of their other funding, that they are no longer going to engage in any activities that would be prohibited by the Global Gag Rule. So now you can see that it's really conceivable that we are going to have providers, that we are going to have partners in country who have no relationship whatsoever with the US government, who are being forced to comply with the Global Gag Rule just because of the way the funding comes to them, because it flows through first a compliant NGO. Again, they're having to comply with this policy that has nothing to do, the funding that they're having to comply on has nothing to do with US Global Health Assistance and nothing to do with any of the activities that the Global Gag Rule is opposed to. The next slide. We talk a lot about impacts of the policy, and I think it's important to remember that the impacts under this administration are going to look different. They're going to look different because of the massive ways in which the policy has, one, been expanded, and also because the world in which the policy is being implemented looks different than it did under the previous Bush administration, for example. We have more foreign NGO partners being impacted because of shifts under the Obama administration, which really intentionally focused on moves to local country ownership. We have increases in uptake and usage of long-acting contraceptives versus a reliance on condoms and pills under previous iterations. And at the same time, the US is taking a step back from access to abortion, both internationally and domestically, at the same time that other countries are moving forward with efforts to liberalize laws. And this policy usurps those local laws in country. Next slide. I know that Patty is going to discuss impacts, so I'm only going to add that the information you share, that you have shared, and Ipas colleagues in the countries in which we're documenting have been so generous with their time, and it's very much appreciated. But those impacts that you are seeing and sharing on the ground are incredibly helpful in our ability to push back against this narrative that's coming out of this administration, that the policy has not resulted in major impacts. When we know that that's simply not true. We know that referral networks are being dismantled, key and vulnerable populations are at risk of, have already lost their service delivery sites, that partnerships are being undermined as a result of compliant organizations who no longer want to speak with non-compliant organizations, and this belief that you can no longer have any interaction. And all of these impacts are ultimately adding up to the undermining of health systems in countries around the world. And the last slide. This is just to say that PAI has a wealth of resources, and we're working to provide a lot of technical assistance to partners on the ground around this policy. We make no judgment as an organization about what an organization should do if they choose to comply or not. Our main goal is to make sure that partners have all of the information they need to make the best decision for them. And there's a lot of work that organizations, even if they are complying, can do to document the impact of the policy, because even compliant organizations are feeling impacts. They're losing the ability to partner with key organizations. There's an incredible burdens of compliance put on those organizations. And obviously the organizations who aren't complying with the policy lose their funding. The US government has lost key partners in key areas around the world. And we're working to document all of those impacts and compiling them in case studies that can be used here for US government advocacy, but also on the part of advocacy in country that a number of our civil society colleagues are leading to try to blunt and mitigate the impact on the ground in countries where this policy is playing out. And let me end there.
Thanks so much, Jonathan, for that very concerning presentation, particularly around the new interpretation of the policy. I want to pause for about 5-10 minutes, depending on how many questions we have, and give attendees a chance to ask questions. Please type your questions in the chat box and I'll read them aloud, questions specifically for Jonathan at this time. And I also want to appreciate, Jonathan, the way that you have translated a very, very complicated policy and rules to very accessible language and PAI's descriptions and diagrams are incredibly useful. I think you've done so much work at PAI to help the whole field understand the policy when that's a really daunting task, considering how difficult and complicated it is. So please type any questions that you might have in the chat box. And as we're waiting for questions, Jonathan, I have one. I wanted to ask whether you or your colleagues have seen any changes due to the Pompeo interpretation. Have you seen that play out in the field already?
So I think the biggest challenge here is that there's a lot of work to help partners really understand what this shift means, and a lot of work that we're trying to do now, just documenting, explaining what this shift means and how partners can navigate and work with this new interpretation. The challenge is that there's the narrative coming out of the administration is that this is not anything new, that this is business as usual. And that's counteracted some of our efforts, I think, to really educate partners on this, when in fact, this is a massive expansion and targeting all of these other donor fundings. And guidance just came out at the end of May. So I think we're still in the very early stages. But I think key to this is partners, organizations who are complying with the policy, really trying to understand who of their sub-grantees could potentially be at risk, and trying to figure out ways to continue those relationships. Donors also play a key role here, and we've been engaging a number of them in conversations as well.
Great, thank you. And I'm seeing no questions in the chat box. I guess, let's see, they're in the question box, that's why. Okay, Jen, I don't know if you can read the question in the question box. I'm sort of having trouble seeing it.
Sure, yeah. I see one that says, let's see. I know that this is challenging to see. I think it's helpful to know the consequences for these organizations if they are caught and not complying.
That's a good question. This is also something that shifted. In addition to this new interpretation of language that came out earlier this year, the standard provisions were updated to make it very clear that if organizations, for some reason, maybe are not in compliance with the policy, that there's now an opportunity to have a conversation with the US government about what happened. This expansion now to all US global health assistance means that we have many, many new partners who are trying to navigate this very confusing policy with no experience. And I think this shift on the part of the US government recognizes that there are likely to be inadvertent slips, if you will, around the policy. Whereas previously, if you were found to not be in compliant with if you were found to be out of compliance with the policy, you would lose your funding, full stop. Now you can have a conversation with the US government, explain what happened, and figure out ways to mitigate that moving forward without having such a punitive penalty against you. And I think that's really important.
Thanks, Jonathan. Yeah, I see another question here that says, can you say more about the impact on other donors and what they are communicating to US policymakers? Are there countries that are affected by the new gag rules more than others, and which part of the world particularly? So those are two separate questions.
So one of the challenges here is that when this policy was first announced, we did, as an entire advocacy community, we did a lot of advocacy with other bilateral governments and really push them to step up and invest in not just sexual and reproductive health and rights, but global health funding, recognizing that at the same time this policy was coming in, you have an administration who's also advocating for massive cuts to US global health assistance, and we needed to work with other donors to try to bolster some of that funding. This policy is a direct attack against some of those efforts that we've engaged in to work with other donors to provide additional funding to support organizations who've lost funding as a result of this policy, to really build up partnerships and collaboration in the field. A number of those donors have been vocal and have weighed in with the U.S. government directly, which is helpful. I think we still have more to do as an advocacy community to really underscore how not just bilateral donors, but also private foundations, how that funding is really being targeted, and really showing that that funding now that's flowing through these organizations who are complying with the policy, all of that money now is impacted. And we also have to balance that with this shouldn't be a shift away from funding those organizations who are complying with the policy. We don't want to see that. We do need to figure out a way, though, that donor priorities aren't dismantled, co-opted as a result of this policy.
Great. Jen, I can take over now that I've figured out how to see the questions, and thanks for all of your questions. Due to time, Jonathan, I'm going to read 3 more and then hand it over to you. The first is from Katie from MNC Saatchi, who's a private company working on demand generation for modern contraceptives, including safe abortion kits. And they're worried that they're over implementing. For example, assuming that we would have to sign the Global Gag Rule as communicating safe abortion as an option, although we do not offer formal counseling. Are we correct in our assumption that communications are included in counseling as a prohibited activity? A couple more questions. How does the Global Gag Rule work for women whose lives are in danger if she doesn't have an abortion, or in the other exceptions, rape and incest? And also, it would be helpful to know the consequences for the organizations if they're caught, if they're not complying. And for those who are not comfortable with the moral argument, the cost of putting this policy in place. People often talk about the Global Gag Rule as a political football, depending on whose office. How will the effect of the expansion continue even after we have a different administration?
So I think the last question is important because, again, what we have seen is when there's a new administration that comes in and this policy goes away, that chill and fear lingers in the field much longer than the life of the policy itself. And I think that we're at even greater risk now with this expansion to all U.S. global health assistance. And now any and all funding, which is really increasing this stigma and discrimination against providers who are providing comprehensive services. And that's something that we're all going to have to work strongly to counteract. And when this policy goes away, when there's a new administration, that's going to be one of the key lifts that we're all going to have to do as a larger advocacy community. The consequences for getting in trouble by being not compliant with the policy. I think if there's a very free, like if you're going against the policy willingly and knowingly, I think that those consequences will be very damaging. The US government has made that very clear. This is, from all intents and purposes, the head of this government is punitive. And I think that that would extend to the political people who are pushing the drive for this policy. And then there was a question around the exceptions. This is something that is really challenging when I'm in the field talking with partners about this policy. And the exceptions in this policy are very narrow. And this policy does not care what the local law says and what local law allows. This policy only allows for the exceptions in the cases of rape, life, and incest, or for a passive referral, which we've talked about on previous webinars, but those are very narrow exceptions, again, and it doesn't matter what the local law is. And unfortunately, this government does not take into account what the local law is. And then, I'm sorry, Patty, I missed the beginnings of the company question. Are they a US company?
I understand it being a non-US company, and the question is whether communications on safe abortion are prohibited under the Global Gag Rule.
So communications, if you're a compliant NGO, it depends on what the communications can be. Communications can be construed as advocacy for liberalized access. Maybe just in the interest of time, we can connect on that one after, because I'm sure that there are some more nuance and specifics there that I'd be happy to talk through.
Great. So I will connect Katie and Jonathan, or we can make sure that you talk afterward. Great. So thanks. So many good questions, and it really shows the complexity of the policy, both in the policy itself, but also in terms of how it's implemented on the ground. So thank you so much, Jonathan, for that. And hopefully there's some new connections that are made here, more than just one, to help everyone understand it better in the field. So now next, I'll present a little bit on IPAS and the harm to the policy, and specifically the harm to IPAS staff and our work with partners. From IPAS headquarters, we're monitoring our country programs and learning from overseas staff on how the Global Gag Rule has harmed our work. In 2018, we began a partnership with the Center for Reproductive Rights and the international law firm Debevoise Plimpton to search for facts that potentially could lead to a lawsuit against the Trump administration. That work is continuing, and therefore information that we are able to share about harm to IPAS work is limited, but still hopefully interesting and useful to folks on the call. Next slide. This US government map represents a relative amount of funding that the US government contributes to global health, and the orange dots are countries where IPAS works. And we had a question actually from Zambia asking if the harm is worse in some places than others. And so I didn't read that question because I think I'll be able to answer it here. As Jonathan said, the US government contributes approximately $9 billion in total in global health. And this is all funding that the Global Gag Rule attaches to one way or another. On this map from foreignassistance.gov, the lighter shading represents a greater amount of funding. So you could deduce by looking here that IPAS programs in Africa have the greatest risk of harm from the policy. Asia, we also see some impact, and less impact, though not none, potentially, in Latin America. Next slide. And to expand on Jonathan's slide about how impacts are different now, we know that US foreign policy has long been out of step in the rest of the world, but the world keeps changing, and US policy becomes more and more disparate from the world. Governments in the Global South in particular have reformed abortion laws over the past several decades to reduce unsafe abortion and promote the human rights of women. While every nearly country in the Global North liberalized their abortion laws between 1950 and 1985, with some exceptions, we can mention Northern Ireland here. Many Southern countries retained old abortion laws of their former colonizers until recent decades. So we know that in the past 25 years, since the 1994 ICPD, over 40 nations have taken steps to liberalize their abortion laws. And of course, following law reform, rollout of abortion services in many cases has expanded access and also expanded the number of organizations working in abortion care and whose work must now, since the Trump administration, change in order to receive US funding. In many countries with more recently reformed laws, or in Africa and Asia, the very countries where the government invest heavily in global health, just to name some countries: Ethiopia, Kenya, Mozambique, Nepal, Rwanda, South Africa. Next slide. Now I'm going to speak about the harm of the Global Gag Rule to the work of IPAS staff and partners. IPAS does not receive funding from the US government, so the harm that IPAS staff sees results from the requirements forced upon our US funded partners, and now perhaps partners who receive funding from other donors with whom we can no longer work. And I'm going to basically talk about 4 areas. One is a loss of community partners, a loss of opportunities for joint projects is number 2. Also silence of advocates for abortion rights, and lastly, lack of abortion training for healthcare providers. And again, this is the way that the Global Gag Rule is impacting our own work. Next slide. In multiple countries, IPAS has been unable to work with US funded partners. And these are partners with whom IPAS has had a relationship with for many years. Because the US government has invested in the capacity of local organizations, those US funded organizations have grown to be the strongest partners for IPAS. But now, because they're receiving US funding, they can't work with us. And our country teams have had to allocate resources to investing in new community groups. In addition, local groups have been unable to participate in abortion work, and we lose their expertise. We learned of one example where a government was working on abortion guidelines and had invited US funded organizations to contribute their expertise in shaping the regulations, but they couldn't contribute. They couldn't help draft regulations, and their expertise was lost. Next slide. We also have some instances where organizations have declined to jointly bid on RFPs with IPAS because they receive US funding and they believe they can't partner with us. Next slide. And our staff has also seen an abortion advocacy coalition shrink when US funded organizations that are supportive of abortion rights have signed the Global Gag Rule and are no longer able to participate. Next slide. And lastly, I'm sharing an example from IPAS Bangladesh, where IPAS offers training and support in abortion care for healthcare providers working in camps that serve Rohingya refugees who have fled Myanmar. Although many Rohingya refugees need abortion care after experiencing rape, US-funded providers are refusing to be trained. Refugees seeking care in US-funded facilities are left without the option to end their pregnancies, even in cases of rape. And as we understand from our Bangladesh staff, even training in post-abortion care has been declined by US-funded organizations and providers. Next slide. So now I want to pause again here to ask for IPAS staff and partners, what harm have you seen, to write in the chat box or the question box? How have you seen the Global Gag Rule impact your work? And again, I'll read those questions aloud read those comments aloud. And also, I'd also like to invite particularly IPAS staff to send me an email if you see any harm in your country work and in the field. And I also really want to appreciate colleagues in the PSTs and also our development colleagues who have been really helpful in raising issues that they've seen in working with our country staff. So I'll pause here. All right. Well, I'm going to continue to encourage our staff to be in touch and appreciate all of the information we're able to gather so far. And now I shall turn it over to Gus to talk about the Helms Amendment.
Great. Well, thank you very much, Patty. As Patty said, my name is Rob Gustafson. I'm a consultant with Ipas, and I had not really focused on the title of our webinar, I must confess, until Patty said it at the beginning, and that is the Global Gag Rule and Beyond. I'm the last speaker, and I'm not talking about the Global Gag Rule, so I think we're just about to step into the beyond. So prepare yourselves. I'm going to talk about the status of activity around the repeal efforts for the Helms Amendment. And I realize that there are a lot of different amendments and pieces of legislation and restrictions that have senators' names attached to them, and they get confusing. But the Helms Amendment is the provision in law that restricts or prohibits U.S. funding from addressing the pressing problem of unsafe abortion around the world. The Helms Amendment has been law for 46 years, since 1973, and it was a response by this conservative senator from North Carolina to Roe v. Wade, as people started to look around at abortion becoming more available and trying to restrict it further as best they could legislatively. So what the Helms Amendment does is it prohibits U.S. foreign assistance from being used to pay for, quote, the performance of abortion as a method of family planning or to motivate or coerce anyone to practice abortions. It's in permanent law, and not only that, it's in the Foreign Assistance Act, but not only that, every year Congress passes the same language in its annual appropriations bill for foreign aid. So it's really one of the most firmly entrenched anti-choice legislative riders out there, and legislatively has really never been seriously challenged. It's something that's kind of as many people know, there's a similar domestic provision called Amendment that prohibits U.S. funding for abortions domestically. And as many people know, and Patty said as well, this is a very uncommon kind of restriction to have. Few of any other donors limit the use of their funds for abortion services. So the thing to keep in mind, about the Helms that prohibits U.S. funding to be used for abortion services overseas is it's really bad policy. It's just a terrible policy in its creation and in its effect. It prohibits funds for a procedure that is legal in the United States. Thank you for changing the slide. I forgot to mention that. Prohibits funding for procedures that are legal in the U.S. It prohibits funding for procedures that, in some circumstances, in most countries where the U.S. operates foreign aid programs, are legal as well. So it stops funding from programs that are legal. It contributes to abortion stigma, which is completely unhelpful, of course. And also, since women who resort to unsafe abortion when safe abortion is not available, since women do that, Helms has undoubtedly, every single year since it's been in place, been the cause or a contributing cause to women dying. So that's pretty much the definition of a bad policy. As Patty said earlier as well, and gave us some really good detail about, countries primarily in Africa and Asia have been liberalizing their abortion laws in response to their national policies and goals of reducing mortality amongst women. And they recognize the need for assistance in implementing these new policies and are asking for help. So this isn't something that we would be, I don't need to tell folks in this call, but for advocacy purposes, this isn't something we're forcing on anyone. This is something that countries are asking for help with. And really all they want to do is integrate safe abortion services into their healthcare systems to reduce maternal mortality. And that's good policy, as opposed to the Helms Amendment, which is bad policy. Not only is Helms bad policy, but all administrations, both Democratic and Republican, have actually made it worse than it needs to be. Jonathan talked about overinterpretation of the Global Gag Rule or overimplementation, and we see that with the Helms Amendment as well. The U.S. could be funding abortion services for women who need access to them because of rape, incest, or the life of the woman being in danger, but all administrations have refused to do that. have decided that that was not something they wanted to do, even though they could legally do it, including Democratic administrations. Next slide, please. So Ipas, as a leader in helping make safe abortion services around the world, has been working to try to either reinterpret or repeal the Helms Amendment, or at least has been actively pursuing this for quite some time. During the Obama administration, Ipas was very active in trying to come up with create a scenario where the Obama administration would reinterpret their implementation of Helms so that they did provide assistance for rape, incest, and the life of the woman. The Ipas worked on documentation of the impact of the policy, and also was pivotal in creation of the Helms Working Group. There's a big group that I'm going to talk about in a minute in DC that many may be familiar with, the International Family Planning Coalition, which is the big international coalition of international organizations that work on reproductive health and family planning. In 2009, that group, not everybody in that group was quite ready to work on Helms, on repeal or reinterpretation of Helms. So Ipas, PAI, and others created the Helms Working Group. That group worked very actively through the entire Obama administration, and there were times when it looked like the Helms Amendment was going to be reinterpreted. It never happened. That was entirely in the Obama administration's hands, and it never happened. And I just say, repealing the Helms Amendment would be a big deal, and it's worth fighting for. I mean, if you can imagine, if the U.S. freely funded programs around the world that help make safe abortion services available for women, and if the U.S. was to provide assistance at the level that the reproductive health and family planning community is requesting, that would add $1 billion roughly to reproductive health and family planning programs. Even a fraction of that money, a small fraction, if it were dedicated to promoting, making available safe abortion services in developing countries, which account for 90% of the mortality from unsafe abortions, it would be kind of life-changing. I mean, it would change the way our programs work, and it would really save a lot of lives. And really, what it takes at this point is for people who support this policy to go out a little bit on a limb and do something about it. So if you could go to the last slide, please. Fortunately, we're at a time now when there's a lot of new energy, not for reinterpretation of Helms, but for complete repeal of it. Get rid of this policy. And I'm going to say this a couple times, but not only get rid of this policy, but replace it with a new policy that says that the U.S. will actually promote access to safe abortion through its foreign aid programs. So the International Family Planning Coalition is 100% behind this new movement to repeal Helms, and is taking a tremendous leadership role along with Ipas and others, and that is incredibly welcome. This is one of the 3 or 4 top priorities for the IFPC. There was also an NGO community blueprint created that came out in July of 2019. It was coordinated by Planned Parenthood, and it was both international and domestic organizations putting down what they want a new administration to advance in terms of policy and planning. And prominent in this document is repeal of the Helms Amendment and replacement of the Helms Amendment with a proactive policy of promoting safe abortion around the world. I'm really happy to report as well that really in just the last couple of weeks, the International Family Planning Coalition has developed, and we're in the final stages of putting kind of the final touches on a piece of legislation that would repeal Helms and replace it with a proactive policy. The next steps there are going to be to bring it up to the Hill and see who might be interested in introducing it. At this point, we're thinking probably primarily in the House, which of course is a little bit friendlier to us right now. In 2016, the Democratic Party platform of the Helms Amendment and funding for safe abortion services in our foreign aid programs. And I have every reason to think that the 2020 Democratic platform will have the same provisions in it. And really, all of this is pointing toward the possibility that there will be new opportunities after the 2020 election when new Congress and new president are sworn in January of 2021. So I'm going to stop there. If folks have questions, of course, be very happy to answer them.
Great, thanks so much, Gus, for that overview. We're feeling optimistic when we look beyond this administration and potential changes that might come to U.S. policy, or at least interest in it, which is the first time that we've seen that since it was enacted in the 70s. So that's really hopeful. There were some, feel free to type your questions for Gus. I see that we have questions from Taylor, Ida, and Charmaine that were not answered for Jonathan about the rules of the Global Gag Rule, and I think it's important that we make sure that everyone can hear that to help us understand the policy. So I'll start with those, but feel free to type in questions for Gus. So to start with, one question is that if you use your own funds and counsel refer to abortion, are you at risk of losing U.S. funds? And the next question, I think, is an important one. I'm not sure that we have the answer, but how do you offer SRH services without the choice of abortion? That's an excellent question. So Jonathan, can you answer that question around counsel and refer for abortion?
Yes, and I should have actually said this at the outset too, to make clear that there's a distinction between US-based and foreign NGOs, so non-US based partners. Just a reminder that US-based NGOs can separate and segregate out their funding because of the protections afforded to them under the Constitution. So a US-based NGO, while they can't with their US funding engage in abortion-related activities, they can certainly use their private funding to engage in those activities and still be eligible to receive US funding. When it comes to foreign NGOs, this is how damaging the policy is. If you want to work with the US government and you want to receive US global health assistance, you're saying that you are taking that US global health assistance, and even with your own non-US funding, that you will not engage in any of those activities. So even with your own non-US funding, you will not counsel or refer. You cannot do any of those activities if you want to remain eligible to receive US global health assistance funding as a foreign NGO. And then how do you offer comprehensive SRH services, I think, is an excellent question. And this is something that we're really working with other donors to figure out and to navigate and highlight the role that other donors have in providing this funding to organizations who choose not to comply with this policy and consequently then lose their US global health assistance funding, but also to use this funding to keep comprehensive service provision happening in countries where there's a strong US presence and you have partners that aren't going to agree to comply. The other thing that donors can do here is they have a role in playing in building up these partnerships. So ensuring that there is communication between organizations in country who are both complying with the policy and working with US government funding, and then organizations who aren't complying and working with other donor funding. We need to have these organizations communicating, and they can work in parallel structures and still collaborate. They may not be able to fund each other, but there still is a need to work in partnership for the good of health systems writ large. And I think it's really important for other donors to push that message.
Great, thanks so much. And do you have a few more minutes, Jonathan, because we have a couple more technical questions and we're at time right now.
I have plenty of time.
Great. Well, for those of you who have to leave, I want to thank you all for coming, and you're welcome to stay. We'll try to get through the couple other questions that are left. And we had two from Charmaine, our Bangladesh staff, who Charmaine has been terrific in helping us understand the impact there. Her first question is, how does a gag rule affect UN agencies? And the second, another great question, why can't the country policy control the global gag rule?
So the UN agency question is a good question. Funding that goes directly from the US government to UN agencies, other multilaterals, that funding, the policy language does not attach itself. So the US funding that goes to the Global Fund, for example, or UNA, it's the policy, the Global Gag Rule is not in those agreements. The funding from UN agencies, though, and other multilaterals is impacted if that funding, now under this new interpretation, flows through a compliant organization, an organization who's complying with the Global Gag Rule, and then is further subgranted. So I think the Global Fund is a good example here. A lot of the work that the Global Fund does is through prime implementing partners at the country level, who then further subgrant that funding. So while US funding that goes directly to the Global Fund is not impacted, the policy language is not attached. If Global Fund funding flows through a compliant organization and then is subgranted further, when it flows through that compliant organization and then is subgranted, then the policy language attaches to the Global Fund funding and would for other UN agencies as well. And then why doesn't the US policy or the local law policy trump, if you will, the Global Gag Rule? The US government will say that what they're saying is that if you want to partner with the US government and accept this funding, you have got to comply with this policy. It does not matter what the local law is because they don't care about the local law. The US government is simply saying, like, if you want to partner with us, this is what you have to agree to. And if you cannot agree to that, then you're not going to get this funding. They're not taking into account any local law whatsoever. It really is for them. It just underscores how ideological this policy is, and that it really is being used to attack access at the country level, to stigmatize and discriminate against providers who are providing comprehensive services within the law. It is still being used to attack those services and access to those services.
Great, thank you. Well put in terms of what the policy sets out to do. Here's a question from Taylor. Is there a gray area for organizations researching the implications of restrictive abortion laws with the Global Gag Rule's restriction around advocate for abortion care? The question is, even if the research passes the country IRB, is it possible to do that research and be US funded?
So the research area is a little bit challenging because there's a lack of very clear guidance around this. But sort of a general rule of thumb is that nothing stops a compliant organization from doing research around, around unsafe abortion and the results of unsafe abortion. So you could say X number of deaths are a result of unsafe abortion in this country. What you can't do is you can't then take the research a step further and say, what the research is showing us is that we should have a liberalized law in this country and use that for your advocacy purposes. It's a fine line to walk, but there are ways to figure out how to navigate that.
Thanks for that. And here's a good question. Unfortunately, the asker has left, but I think it's a good question to end our session. And the question is, what is the status of the Global HER Act?
So the status of the Global HER Act, thank you for that question, is that we have never had as many co-sponsors in the House and Senate as we've had now, which I think is a testament to all the advocacy that's been happening even before this policy came back into effect, and really recognizing through a lot of work through a very collaborative partnership and coalition, how this policy plays out in the field. The legislation is introduced in both the House and the Senate. As part of the appropriations process in the House, we had full repeal of the Global Gag Rule included. We have strong Senate support. Unfortunately, that language wasn't included in the appropriations bill in the Senate, but we're heading into a conference meeting in a very strong position to advocate for that language. But even if that language doesn't, if that legislation doesn't advance, I want to be really clear that we have members in both chambers really speaking out and taking this administration to task whenever they're up on the Hill defending budgets or in committee hearings, really pushing them and highlighting the impact that we get from a number of partners from the field and making them confront the impacts that this policy is having already in the field.
Great, thanks so much. And it looks like we got all the questions done, and another question about where are resources regarding research on the Global Gag Rule. And I'll just offer that following this webinar, we'll send emails to all of you with the recording and then also links to research resources, also how you can get in contact with PAI for questions. And another plea from me, particularly for our IPAS staff, if you hear anything about the way the Global Gag Rule is affecting our programs, please be in touch. We want to keep track of that. So thank you, Jonathan. Thank you, Gus, for your presentations. And thanks for everyone who came. I think this is important. It's concerning, but we need to do all we can to understand the policy and look ahead for when we don't have this administration and we can work toward repeal of Helms. Thanks very much.